So far, we discussed some of the potential benefits of dietary fiber, but we left out the most heated topic, which is about fiber and colon cancer. Now, where do we start? Volumes could be written about the relationship between dietary fiber and colon cancer. It's a very difficult topic, fraught with methodological issues. The relation between fiber and colon cancer epitomizes the difficulty in establishing solid relationships between a food component on the one hand and a risk for disease on the other hand, and this is especially true for cancer. The general consensus that actually plenty of nutrition scientists disagree with is that a high fiber intake protects against colon cancer. Now, this consensus opinion partly underlies the recommendation to increase consumption of fiber-rich foods. The basis for this recommendation are different kinds of observational studies that have examined the link between fiber and colon cancer. Famous early ecological studies by Burkitt and others, they found that colorectal cancer rates were lower in countries with a high fiber intake and higher in countries with a low fiber intake. But I repeat it once again, we should be careful not to get carried away by ecological studies. Now, what about case control studies? A number of case control studies, but certainly not all, found that fiber intake is lower in colon cancer patients as compared with control patients. But then, a series of prospective cohort studies, including the famous Nurses' Health Study, found that people with a low fiber intake did not have a higher chance to develop colon cancer as compared to people with a high fiber intake. Now, in contrast, the world's biggest prospective study, which is the European Prospective Investigation of Cancer and Nutrition, also called EPIC, with over 500,000 participants, found something else. They found that the 20% of the people with the highest fiber intake had a 40% smaller chance to get colon cancer in comparison with the 20% of the people with the lowest fiber intake. Now, the scientific discourse in response to these conflicting findings ends up being very technical and rarely clears up the air. A very important argument that is brought up is that it's impossible to find a relation between fiber intake and cancer if the population being studied shows very little variation in their fiber intake. A recent meta-analysis published in the reputable journal Gastroenterology concluded that dietary fiber reduces risk for colorectal adenoma, which is a pre-stage of colon cancer. The 2007 expert report of the World Cancer Research Fund and the American Institute of Cancer Research classify the association between fiber and colon cancer as probable rather than convincing. However, the same panel more recently upgraded the fiber-colon cancer connection to convincing. Overall, it is recognized that Western populations do not eat enough fiber, and that an increase in fiber intake would improve health. Consumption of fiber-rich foods is therefore part of the general dietary recommendations in many Western countries.